we take an inclusive educational and community development approach to mental health and well-being in the community. So our work, our approach moves participants beyond the scope of traditional mental health spaces and moving beyond kind of illness identities towards being empowered community members with a focus on enhancing their strengths. We've been working since 2016 with organisations throughout Laoghaire and North Dublin, with over about 50 organisations. So it's a very collaborative community approach that we take. It's non-formal educational courses that we run. We also provide training and community development initiatives. We run mental health and wellbeing festivals. So normally we bring people together to celebrate mental health, which is quite new because there's traditionally so much stigma around that area. The Mental Health Champions program, it came about because we had we were collaborating already with the AES in Balbriggan, and then there's just a wider need, a need recognised in the area and through adult education generally, that there's a bridge to be, a gap to be bridged, I should say, in terms of people who have experience of mental health distress, that when they're looking to reintegrate and move forward with education, actually when they're getting back into education for the first time, that can be quite like a challenging space, and there's quite a lot of drop off. That's what the research shows. So it was Siobhan in Fingal AAS came to us with kind of to explore the possibility of running a program under the Healthy Ireland Fund program, and with a view to building the capacity of local community stakeholders to design and deliver recovery educational programming that would be non-formal in approach. So it'd be very accessible for people who are just getting back into education, but it also helps create a culture of acceptance and recovery in the community because it's open to everybody. Our courses aren't just open for people with mental health distress, it's recognising that everybody has mental health and we all need to look after it. So that's kind of the background to it and the ethos of the programme. Well, I think that partnership has been like a huge kind of foundation stone for the programs that we're running currently, and kind of in particular, I think it was really clear from the outset when we were meeting with yourselves, the meeting between the AES and the Recovery College. It was just from the outset, just there was a really strong shared value base, which really helped kick things off. I think both sides of the partnership really got what we wanted to achieve. I think working through a pandemic for everybody, that's just really, really challenging. And when you're trying to set up a new partnership and a new approach, and then all of a sudden, it definitely affected the timeline and scheduling. We were going back and forth, just trying to find a way when actually can we start this process, because it was put back a few months because of the restrictions that were in place. The intention was to bring people together in a physical learning environment, and that's normally how we would work. But as a lot of organizations have had to do, we just put our heads down and put them together. Well, I suppose building on when I mentioned challenges, the successes here at this course or this program, just to mention that as we're going to look at next steps, is I think based on the work that we've done, we can see that there's a real solid value that there's a buy-in from community groups in the area. Then in terms of immediate next steps, we're developing those the session plans for phase 4. And they're the courses that were developed by community stakeholders in January and February. So those courses are entitled Developing Your Own Wellness Toolbox and Helping Myself and Others. So those two courses will be running between mid-May and June. So that'll be the end of the 4 phases after we deliver those programs. From there, we'll be submitting a full proof of concept report, and that's based on the evidence that we're collating at the moment, and we'll have testimonies to back that up. But basically, hoping that report can help us further embed the work then in the Fingal area, when, like, you know, supporting agencies and funders see the value of the work for themselves. And I suppose one natural development that I'm seeing happening in the courses, and I mentioned that the linkages that are happening between people from very different backgrounds and organizations that mightn't necessarily get to know each other as well as they're getting to know each other in the courses that we provide, is that also, you know, with respect to like kind of culturally appropriate mental health approaches, I think like a natural move forward for a program like this could be to work directly in with marginalized communities and their supporting agencies. So with a view to building their capacity to, like, you know, whether it's people coming from ethnic minority communities or people that living with disability, lone parents, that actually different groupings could be supported to actually deliver these programs and design them themselves. So I see that could be a natural next step for this. But I think we have to be able to stand over the work that we've done so far before moving forward.